Welcome to MedShark Insider with Bill Fukui, your expert host on all things medical marketing and SEO.
Welcome, everybody, to another episode of the MedShark Insider. And today we're going to take a little different approach to some of the content we're going to be providing. And it's not necessarily from a practice management perspective, but something that I think boils down to what our patients, our consumers, what is it that they're asking, and really how do we need to be addressing some of the questions that they have. And today I have plastic surgeon Danielle DeLuca-Pytell, who is I've known for a number of years now, and she has her own private practice. And I'm going to have her introduce herself and a little bit of background that she has, but also we want to get into some of the questions that consumers are having, and really how do we address some of those common questions that I think is really important, because this is something that I think practices have to deal with every day, and how you position certain things makes a huge difference in terms of their understanding and also your credibility. So welcome, Dr. Pytell. How are you today?
I'm doing just fine. Thank you so much for having me on your podcast, Bill. It's really nice to be here. So as you mentioned, I am a plastic surgeon. I'm a board certified plastic surgeon, currently in private practice in Troy, Michigan. This is sort of my second life as a plastic surgeon, because the first half of my career was in New York. And in that second half, I am now 5 years into my own private practice, even though I'm nearly 20 years into being a plastic surgeon. So we could talk about business of medicine as well, because I seem to have a lot of different models of background for that. My private practice is a boutique setup where we are looking to take care of one patient at a time with integrity and extreme quality. And it's a pleasure to talk to you about some of the things that I'm really passionate about in plastic surgery.
Yeah, no, that sounds great. And you're right. You have a different background than many of our surgeons, and I think some of your perspective is actually a little bit different. And also, I will also say that I have clients of all types, but I will say female plastic surgeons. There's a specific thing about that when it comes to consumers, and I'd like to address some of that. But you had also mentioned being board certified, right?
Yes.
And you were very intentional about that.
Yes.
Why? Why the intent of being, mentioning board certification, whether you're introducing yourself to me or anybody else? Why is that important?
Sure. It's almost a difficult thing to answer because you can come at it from so many different ways. But essentially, board certification is a stamp of approval from the highest ranking medical specialties,
Mm-hmm.
and it proves that you have gone through an accredited residency, and then you have passed the final verification process, or final test, that you are a safe and competent plastic surgeon. So I am very proud to be a board certified plastic surgeon. It took a long time to get there. We have first a written exam, and then we have a grueling oral examination where we collect all of the cases that we do over a 7-month period. We submit all of the cases to the American Board of Plastic Surgery. They select 5 cases for us to prepare in depth. And basically, they can look at the way that we have cared for patients from really top to bottom. And that includes lab results, it includes all of your notes, it includes medical photography. And if any of those things are missing, then you also have to prepare extra cases. So unfortunately, I had a patient not consent for photos, so I had to prepare 8 cases. This took up an extremely large part of my life. In addition to having to prepare your own cases, you then have to go defend them against a panel of board examiners. So all the people that are interested in being board certified travel to Arizona. It's over a long weekend, and you have different oral examinations where you have a set of unknown questions where you'll be asked about typical plastic surgery cases and how you're going to manage them. And then you present your own cases. And it is really, really intense to speak to people who have had, years of experience about how to manage a case. Maybe it's about plastic surgery you don't really do, but you have to demonstrate that competence so that, again, people know that you're safe.
Hmm.
And what's really important about this is that plastic surgery is recognized by the ACGME, which is the Accreditation Council for Graduate Medical Education.
Hmm.
So plastic surgery is an accredited medical board, like internal medicine or pediatrics. What is not an accredited board is the American Academy of Cosmetic Surgery. That is not the same caliber. So for plastic surgeons, this is an important distinction, and for consumers, we can't educate them enough that there is a difference between being board certified by the plastic surgery boards and the cosmetic surgery boards. Actually, in California, there was a law that said that cosmetic surgeons cannot advertise as board certified because their training is not equivalent. And they really are protecting the consumers in California to ensure that those patients are not being duped by a false board.
I actually have been in medical advertising and marketing for like 30 years, right? And even people that are in the business, vendors and such, they're not as even knowledgeable about the specific. There's a limited number of medical specialties that are recognized, right?
That's
Not
correct.
every medical specialty, quote, specialty is actually recognized as a quote specialty. And I think that's really important to know that they've identified these as critical to having a criteria to determine board certification, because it's not every medical uh, practice has the ability to have a board certified, somebody to certify them as being, like you said, qualified, highly qualified, going through a credentialing process. And actually, you brought up something that I think is important for even our board plastic surgeons, that they may not even recognize, is that actually Google's recognizing that now. Google's actually recognizing for the first time that it now offers what it refers to as local service ads. These local service ads, you have to be verified. You have to go through a credentialing process with Google in order to advertise as a quote plastic surgeon, right? And one of the criteria is exactly what you just said. You have to be American Board of Plastic Surgery certified. You have to be a board certified plastic surgeon in order to do local service ads. And I think that even in and of itself is a measuring stick as to the importance. Google's put enough
Yeah.
importance that you have to be board certified. I think that even says a lot.
Yeah, and I was really excited that Blue Shark recognized the importance of this for my business and immediately flagged, you've got to get in on this. And it took a couple of weeks for Google to recognize me as being a board certified plastic surgeon. So
Mhm.
you go Google, that's impressive.
Yeah. No, and I love all of that. I think it helps differentiate, and maybe it'll never completely unmuddy the waters. There will always be some of that, but I think anything that Google, that the states, or to help consumers distinguish the difference, and help identify the qualifications, because everybody has, like the board, these certificates on the wall behind them and stuff.
Yes, I have lots.
Right, and you've got lots, right? But the average consumer needs to know what they need to know, right?
That's right. That's right. And
And
our our societies are very small. Like there's only so many board certified plastic surgeons in this country, and we have a voice, but it's our voice unfortunately is not as loud as others. And this is the kind of stuff the news media loves to hear about some sort of a disaster when it comes to,
yeah.
cosmetic or plastic surgery. So everybody knows, unfortunately, about the young mother who died having liposuction, and that liposuction was performed by a pediatrician. And that pediatrician might have been a board certified pediatrician, but certainly wasn't a board certified plastic surgeon. And those are the tragedies that can be prevented by just taking the time to do a little bit of homework and figure out, is the person that's helping me really qualified to do so?
Right. So in layman's terms, if you're talking to a patient and they say, well, what's the difference between a cosmetic surgeon and a plastic surgeon? Is there a difference?
Yes.
How do you
So,
address that?
so cosmetic surgery is one of the many branches of plastic surgery. And all plastic surgeons have the opportunity to be cosmetic surgeons and are all trained in cosmetic surgery. Cosmetic surgeons can come from a variety of different specialties. So the other board that I mentioned, the American Academy of Cosmetic Surgery, not an ACGME recognized board, allows people to come in from pathways such as general surgery or emergency medicine or other non-core surgery specialties. And the problem with this is that they don't have the same kind of background and training that plastic surgeons have. And in addition, they don't have the opportunity to take care of complex wounds or to do reconstructive surgeries. All of those things play into how you care for a cosmetic surgery patient. So my practice of cosmetic surgery has been helped immensely by my prior life as a reconstructive breast surgeon and my prior life as a wound care surgeon. And I laugh sometimes because, well, I don't laugh at this, actually, I get kind of frustrated. If I have somebody who has an unfortunate complication and requires some wound care, I now kind of go overboard and explain, like, you have a wound, I can heal wounds, this is part of my training. Do not be concerned about it. You're still gonna have a good result. It's just gonna take a little bit longer to heal, because unfortunately, I do have a lot of patients who, if they have a question or problem, they don't pick up the phone and call me. And everybody gets my cell phone number, so there's no problem. You can always call me. But they go to their Facebook group or their social media group, and very well-meaning people will say things like, "Oh, your plastic surgeon can't possibly help you with that wound. You have to go see a wound care specialist."
Yeah.
I mean, plastic surgery, we do wound care. Like that is part of our core specialty. And I'm being told by somebody who asked Dr. Google that, no, I need to go to the wound care center, and the wound care center is run by nurses, which is not a problem. I mean, they can put on dressings, but again, they don't know how I did the surgery. They don't know what I'm doing, what my plan is. So there's just a lot of buzzwords that people need to, I guess they need to be aware. And one of the things that I think is so important is to make sure, I mentioned before that I have, a very unique individualized practice. I spend a lot of time talking to my patients. I want to get to know them. I want to understand where they're coming from, because for me, plastic surgery is a relationship. I meet you, you tell me about yourself, you tell me what your goals are, I examine you. If we're a good fit and I can help you, then, we're going to be a match, and I'm going to help you along your journey. Nowhere along that journey do I ever want somebody not having enough trust in me that they would go to the internet to look for their answer. But a lot of practices, and some of the ones that, are part of the medical tourism issue in Miami, they're kind of like a little factory. People come in, they get seen by a coordinator. Maybe they don't see their surgeon until the day of surgery. They get sent on a plane, they go home. There's nobody to care for them afterwards. So we're really putting a stop to that, and really putting first and foremost, that relationship is important. I love the idea that somebody sees me on social media and wants to have surgery with me. But if you live, 1,000 miles away, maybe that's not the most convenient thing. And if somebody does come and want to have surgery with me from out of town, then it's a commitment. You really need to stay in town for a while, because I can't just let you go, because if you're not in front of me, if you're not in the same state, I'm not going to be able to help you if a problem arises. Not that problems arise all the time, but nobody wants to be the one person who's suddenly in the middle of nowhere without their plastic surgeon.
That's a great point. And especially when you're talking about, we live in such a social media world today, especially our patients. Cosmetic patients absolutely live in kind of a social media environment. I think I was actually at a society meeting. Actually, I just flew back from a medical meeting, And there was a study that had the average American will spend over 3 hours a day on their social media platforms. That's
That's
the
frightening.
average American.
Yeah,
And I think our plastic surgery and cosmetic patients are actually spending more time than the average.
they might be.
If I had to guess, right? So I love the fact that you're really trying to do what's right by this group of consumers, that there's way more information, and I hate to say it, there's a lot of misinformation, when it comes to the internet and especially social media. I think that, having access to surgeons that are willing to speak, candidly. I'm not here to sell you anything, right? I mean, that's the goal
Right.
and that's what you take up as an oath, is really to do the right thing.
I mean, that's the core of our profession. And if you can't do that, then there's a big problem going on.
Yeah, there's a problem.
Yeah,
So kind of maybe a separate question. Take it to the next level. I'm a consumer. What steps? I understand the board certification, but how do I go about finding, if I'm going to try and compare providers? I know I want a procedure done, right? And it could be liposuction, tummy tuck. In my case, it would be liposuction. Um, but
everybody says that.
but um, what would the steps be? What would you recommend, if it was a friend or somebody that's, how would you go out and find the right plastic surgeon for you?
Sure. So you can search for a board certified plastic surgeon in a couple of different ways. You can go to the American Board of Plastic Surgery website and you can type in your zip code and you can look for plastic surgeons in your area. There are two national organizations for board certified plastic surgeons, the ASPS, or the American Society of Plastic Surgeons. They have the same Find a Surgeon tool finder. And we also have the Aesthetic Society, same way. If you don't know anything about those websites and you don't know how to select someone, um, asking a trusted medical professional, asking your family doctor,
Oh,
or somebody who's in the area that maybe goes to your local hospital that might have seen this person working. It's I do understand that some people's voices are louder than others, and the American Society of Plastic Surgeons has a really nice do your homework campaign, but if you don't know that it's out there, it's hard to find.
yeah.
Um, but if you do a search for board certified plastic surgeon in my area, and you find the American Society of Plastic Surgeons or the Aesthetic Society, it's as simple as putting in your zip code.
Hmm.
Beyond that, I think it's like a big purchase for anything. You kind of have to try things on. You have to visit some people. You have to see if you're a match. You have to go to their office and see how you're treated. How does the person that picks up the phone respond to you when you call? How do you feel when you walk in their office? Does the surgeon take enough time to talk to you? Do they answer all of your questions? I think that even that among surgeons is very different. Um, I'm a big talker, so I like to spend a lot of time getting to know my patients and understand kind of what they're looking at and what they're looking for. Because I can do an awesome surgery, but if I haven't figured out what their expectation is because I haven't spent enough time talking to them, then it doesn't matter how great my surgery is if their expectation is that something else was going to happen.
Hmm.
So, if we're directing this for consumers, start by the Aesthetic Society or the ASPS website, find some people in your area, go on a couple of different consultations and see what fits best.
I love the idea of just not going to the first one, having the first one you go to be the one. I love the idea of going to two, three, until you feel like you could make the decision, right?
Right,
I found the right one, and I think once they reach that point, then that could be on the second or third one. It may be the fourth or fifth one. Who
right.
knows, right?
It could be the
Um,
first. It's kind of
it
like
could
buying a
be,
house.
right?
What happens if
Oh,
the first house you go to is the one you love, but you have to keep going and making sure. especially if this is something you've never done before, you don't know somebody who's ever had plastic surgery. If you do, we have a lot of word of mouth referrals.
Hmm.
Then, that might make it a little bit easier. If somebody
Yeah.
comes with an extremely high recommendation, then, that's the kindest thing that someone can do for me is send me another patient. So,
Yeah.
that's another way if you aren't sure,
Hmm.
to find a good surgeon to fit.
Well, that sounds great. One of the things that I have found, me personally, um, I am gravitated towards female providers. I don't know why, um, but my dentist, my orthopedic surgeon, my my general practitioner, they're all women. I just feel like they have a better bedside manner. I think they listen to me better. I think they generally listen better, at least compared to when I had male counterparts. Um, is there any benefit that, I mean, for me, like my daughter's finishing up her fifth year residency program in New York City, and I'm like going, well, yeah, I'd go to her, kind of thing. I would trust her. Um, is there any studies or anything about female plastic surgeons? Because I still think it's still a man's world. I think most of the providers, when I look, statistics are it's still dominated by male providers.
It sure is. So that was a beautiful segue into a great study that was reported in the Journal of the American Medical Association, looking at long-term outcomes for surgical results from men versus women surgeons. Now, it's not plastic surgeons, it's all surgeons. So it includes general surgery, urology, vascular surgery. But what they have shown is female surgeons have better outcomes at 30 days, 90 days, and a year. So they report outcomes in terms of whether or not there are complications, whether or not there are deaths. And statistically significant, women surgeons in every single time marker have better outcomes than male surgeons. So while I would love to say that means, of course, you should come to me because I'm going to have better outcomes, what does it really mean? It really means that women do something different, and especially in surgery that has always been a male-dominated field, we need to
Mhm.
look at our female surgeons and figure out what's different about the way that they either communicate with their patients, the way that they do their surgeries, that gives them this leg up on
Yeah.
on men.
And that, you know what? And it's not a gender thing. It's how do we make medicine better, right? At the end of the day, that's what it is. And if there are some of those differentiators, then like you said, we need to look at that.
Yeah,
What are they doing that's different? And maybe that my thing is, are they just listening better? You
well, I
know,
think that part
are
of it
they?
might be that they're listening better. I know in plastic surgery, there's only 16 or 17% of board certified plastic surgeons that are women. The number is consistently increasing because our residency programs are half and half now, half men, half women.
Hmm?
But we're still the minority. But the majority of our patients seeking plastic surgery are female. So it's very interesting having a provider of plastic surgery, and I don't like that word just because I spent a
Uh-huh.
long time becoming a doctor, but um, a physician or surgeon who is a woman taking care of a woman. So I had always noted in my clinic that my follow-up visits always took so much longer than my male counterparts.
Hmm.
And when I was moving from my practice in New York to my practice in Michigan, I teamed up with a friend of mine from medical school who was a man, and I followed him around for the day, and I would go into his follow-ups with him, and they would last about a minute. And I would say, are all your follow-ups like this? He said, yeah, I go in, I check them. If they're fine, they never have questions, I come out. 100% of the time, I go into a room, people want to talk to me about how they're feeling, what's different than they thought it was going to be, challenges that they're having. They want to have a discussion. And I think that by basis of me having the same gender, I have a lot of similarities with my patients. I'm a mother. A lot of my patients are mothers. I have
Hmm.
children. A lot of patients have children. We have those commonalities, and I think that sometimes my patients feel more comfortable asking me these questions than they might ask a male surgeon.
Right.
Um, and I think that there's a big a big part of that. I think also that when you come from a place where you have something in common with your patients, and you break down that hierarchy of like doctor or patient, and you
Mm-hmm.
come at each other from more of the same footing, it makes it easier for conversations to happen as well. Um, and I typically want to know if there's anything going on so that I can be better. Are you having any
Mm-hmm.
issues? What did you think about your pain level? Was it a hard recovery? Was it not a hard recovery? Uh, So I'm not really looking to race through um, my follow-ups, but I will say it's different because even with my assistants in the office, we're all women, but I will have them go in first and I'll say, "How's everything going?" "Oh, she has no problems, no questions." And I go into the room and suddenly, there's 4 or 5 things that they didn't want to talk about with my
Mm-hmm.
assistant. They wanted to wait and talk about with me, which
Right.
is fine. Um, but I just think it's having that commonality that allows them to open up. And when you do that, I think you can get better results because I can explain things that maybe they're holding on to that they didn't think about or they didn't understand, and I can give good feedback like, we're not all we're not all shaped the same.
Mm-hmm.
So I have a lot of patients who will say, "Oh, I still feel like," I do a lot of tummy tucks. "Oh, my belly still feels big or still feels swollen." And I'll show them, like, look at how strong you are. Look at where this fat layer is. Think about what your abdomen does. Like, you're not supposed to have a board flat abdomen all the time. You're supposed to be able to have expansion if you're eating a big meal or if you have something that causes some intestinal gas, you have to be able to expand. And of course, you're going to be more flat in the morning and you're going to be fuller at night. And all these things are so normal.
Right.
So this moment of normalization that I can do with people, but also let them know like you're okay. Like
Mm-hmm.
that's a big part of my job too.
You even have the I don't know if it's a slogan or whatnot, being the girlfriend plastic surgeon, right?
Yes, yes, I am
Um,
your girlfriend, the plastic surgeon, soon to be trademarked.
and you know what? I think that's so appropriate because when I get practices, when we secret shop practices and we train intake staff, most of the time when I ask, what's the most common question that patients will ask when they call in about any given plastic surgery procedure or cosmetic procedure, and they'll say cost, right? It was like the first thing everybody, oh, it's cost. Everybody asks cost, right? And then, some of them will say, when they do that, they automatically just put them in a category, they categorize them as, oh, they're just price shopping, right? They're just price shopping. When you kind of already pointed out, not everybody knows what to ask, right? Or
Right,
or what to say, or and cost is almost kind of the common denominator, right? It's I can say cost, and maybe hopefully we can get a conversation going where I can actually ask more details or whatnot. But when you just shut me off when I just say, what's the cost of something, and then nothing goes from there, right? It's like you're when you go in as a surgeon, all of a sudden you peel back the onion, whereas all we did was just take what they said and leave it at that, we never really get to that person, right? We kind of
right,
miss it, right?
right.
So
And it's not all, and it's not, I'm going to circle back to the cosmetic surgery part. Um, it's not all about, you know, the cost of the surgery. Like you have to really think what you're paying for. So when people, for example, they travel out of the country because it's so much less expensive to have surgery if you go to Mexico because you get a vacation and a flight and you stay at the hotel. But what are you getting? You're not getting, like, my patients have access to me forever. Like, you have a surgery with me, I'm your surgeon forever. So you have a question, you can come back. You can pick up the phone and call me. You want your medical record, you can have your medical record. You don't have that kind of access. And God forbid you have a complication, then you're really stuck.
mhm,
And the strain on our emergency rooms is really significant. I read another study when we were talking about this on a national level that the Miami airport routinely runs out of wheelchairs. So a person who is perhaps elderly or has a disability who needs a wheelchair to go through the airport, people that are flying in to have
ain't
Brazilian butt
kidding.
lifts are taking all the wheelchairs. Um, And then there's issues with them sitting on planes. They don't want to stay in their seat because they're not supposed to sit on their bottom. Like this is sort of the definition of poor planning to me. Like, yeah, it sounds like a bargain up front, but you have to kind of think it through and put all the pieces together.
Mhm.
And it's really not. You shouldn't use your coupons and your Groupons for your cosmetic surgery. Like save those for when you're shopping for shoes, and look at what you're paying for.
Yeah. No, and I think there's and I think as I will say, just my own opinion, I think people are, anytime there's a big wave like this social media wave, everybody just kind of jumped on board. But I think over the course of time, consumers become a little bit more skeptical. Skepticism, it takes a period of time. It's the euphoria or this be the first one and everybody jumps on board. And then all of a sudden, when you start seeing all these other issues, like you're just bringing up, now all of a sudden, I think generally people that we talk about Dr. Google and other stuff, I think people are becoming a little more skeptical of the things that they're seeing online, even though there's a lot of misinformation and stuff. I think more of them are coming in and asking the right questions. There was a time with Google even where people didn't go to Google. When people went to Google, they looked up a plastic surgeon's website. And then they went to that plastic surgeon's website and typed in, I'm interested in this. And then they post the questions, right? What's the recovery time? Or
Mm-hmm.
can you do this? Or I've got this. What would you recommend? Those kinds of things. Now they're going straight to Google to ask that.
Right.
They're almost bypassing, and they're just asking those quote queries to Google, and Google's pulling in, and even with AI and everything else, it's just pulling in information to help feed up the best information it can, but it's still not a board certified plastic surgeon kind of thing.
Right.
So
Correct.
so I don't know. I could talk about that topic all day long in terms of social media and consumers, how they're managing medicine through the internet and virtual, all this other stuff. Well, let me ask you, do you do much in the way of like virtual kinds of stuff or
Yes.
communicating with clients, patients in that way?
So we figured out during COVID that we could see patients virtually and we could get almost everything taken care of in an electronic visit. So I see my weight loss patients through telemedicine after I've met them for the first time in the office.
Hmm.
And I will see patients who do not live close by for a long-term follow-up. I have done some consultations prior to meeting people virtually, but at some point for my practice, I need to lay hands on them.
Yeah.
So there's only so much that I can do virtually.
Hmm.
Um, but I think, the convenience of how do you access your surgeon? You
Right.
bring up a really good point because I know that I listen to an ad on the radio all the time about, I think it's ZocDoc, that
Mhm.
you can find a board certified provider in your area. It's somebody who takes your insurance, somebody that'll listen to you. It's very the way that um, the way that people obtain their medical care has evolved so rapidly over the last couple of years. I mean, there's an urgent care on every corner, and
Yeah.
people go to urgent care with things that really should be at an emergency room, and they don't know the difference as to why they go to one versus the other. They're going because they assume the wait's going to be shorter at urgent care,
Hmm.
but they may not have a well staffed
Hmm.
staff. So I I have a whole lot of thoughts and opinions about the way that medicine is progressing currently, and I won't go into those details, but it's I think it's interesting. I don't need to have my patients drive to my office and sit for a relatively quick visit to know if the weight loss medicines that they're using are effective or not. They can
Right.
tell me if they've lost weight or not, and I can tell them if they should increase their dose or not. So
Right.
that's been something that we can pretty easily do with telehealth.
Hmm.
I have found that sometimes postoperative checks are hard because poor connections, poor lighting. Sometimes you really can't see what's going on.
Right.
But for just for a check-in, like, is everything okay? That's fine.
Hmm.
But I'm really a hands-on person.
Yeah, no, and I think the uh, judgment, in terms of when and where to apply telemedicine or telecommunication in healthcare, I think, I think better safe than sorry, right? And I would always prefer but in certain circumstances or in certain, processes, it's appropriate, right? There
Yes,
is some value, and I'd rather do that than a patient just not even come in or not
correct.
do the follow-up because it's too inconvenient. At least do this, right?
Yes,
At least fill a gap where otherwise they wouldn't even come in or see me at all. I wouldn't have any, it at least does that, right?
correct. Yes, I agree
Um,
with you.
and I will say on the urgent thing, I just have to add this. I had a coworker, one of my employees. Uh, he was actually having a heart attack,
Mm,
and he was on the phone with his mother one morning. And he was saying, he's having pressure against his chest, not breathing very well, and his mom said, "You have got to get to the hospital now. Hang up the phone, call 911." He's like, "No, I'm okay." And of course, it's denial, right?
right.
So he's like, "No, no, no, I'll go to the urgent care down the street. There's just one right down the street." So he does. He goes to the urgent care, and then they have to airlift him from the urgent care over to the hospital through helicopter. Craziest thing, he's calling me on his cell phone when he's in the
Oh my
helicopter
gosh.
saying, "I'm not gonna be in today." Just like going, "What are you doing calling me on? Go to the hospital. What are you doing?"
Yeah, it's funny. We had somebody who unfortunately lost the tip of their finger in an accident, and that's a hospital trip.
That's a hospital trip.
Go right to the emergency room because you're it's a little more complex.
Yes.
It's not a sprain. It's not, I
Mhm,
have a really bad headache kind of thing, or I have a urinary tract infection. Those are the quickies, but or like a simple laceration,
yeah,
something that could be easily closed by someone. Um,
yeah.
yeah,
Well, we have to definitely have a separate conversation at another time. There's so many. I enjoy our conversations. We could talk about a ton of different stuff, but I appreciate all your insights, especially for the general consumer. The general consumer is what we're all about here anyway. When we can talk about the business of medicine, but it still boils down to the consumer. So I appreciate all your time today and great comments. And we'll just have to schedule another one to talk about some other stuff.
sounds good. Well, thank you so much for having me on. I really appreciate the time to talk to you, Bill, and everybody too.
Super. Well, have a great afternoon, and we'll
You
we'll
too.
be chatting with you soon.
Sounds good. Bye-bye.
Okay, take care.
Bye.
Thanks for joining us for the MedShark Insider with Bill Fukui. Join us next week for another dive into all things medical marketing. All episodes can be streamed at www.medsharkdigital.com/medshark-insider.